So I've talked previously about hybrid procedures and anterior lumbar interbody fusions. What about posterior spinal fusion? When do I use posterior fusion with pedicle screws versus only anterior fusion? This shown here is an anterior and posterior fusion. There are cages within the disc spaces, and there are pedicle screws and rods in the posterior aspect of the spine. A lot of times I only go anterior, so I just put a cage or a bone graft and a plate, and that's it. Surgery's done. But occasionally I add screws posteriorly, and you may be asking, why would I do that? Why do some patients need screws and others don't? Well, I typically will add screws to an anterior lumbar interbody fusion if you have bilateral pars fractures. There's a region of the bone here called the pars that connects the vertebral body to the posterior elements. So if you have bilateral pars fractures at L5S1 with a steep slope, that's a lot of stress for the interbody fusion cage to hold. So sometimes I'll add posterior screws to that.